Welcome, everyone. Happy Commonwealth Day. I'm Dale Gardner. I'm the chair of the International Implementation Group. So welcome to our Commonwealth Day celebration and webinar. If you feel free to leave your cameras on so we can see you in whatever you're up to. But if you can't, don't worry, just leave your cameras off. But lovely to see you if you can join us. Obviously, we can't see those on YouTube. If you can mute your microphone, that would be very helpful. But we will try to mute you if you can't. We've got a number of talks. We've decided to have quite some short talks today, just like really just like 10 minutes duration, and then having some questions afterwards. So if you've got any questions, feel free just to put your hand up, and I'll take them at the end of every talk. So hoping to have a really good discussion, great variety of talks. But to launch us off, I'm going to ask Dr. Satya Sharma, who's sort of the founder of this project and is the chair of the custodian board, to give you a warm Commonwealth Day welcome.
Thank you, Keith. Thank you, Dale. You've already been welcomed, but I'd like to add my welcome as well. 4 years ago, when we started this project, we weren't entirely sure how this is going to go on, how much participation will be there, and what exactly to expect. Difficult to know. However, over a period of time, it has become quite clear that the project has achieved a number of things, and most of those things are known to most of the people who are here. Now, we still remain hungry, and webinars which are going to be arranged like this one every 2 months would be very, very nice to whet our appetite. So welcome all, and I'm going to hand it over to Keelan for the first speaker. Thank you.
Thanks, Satya. So yes, we have a number of talks, as Dale said, for today's session. We're going to start off with Dale, our own Commonwealth Tribute to Life International Implementation Group Chair, who's going to present on the global data and the global situation around organ donation and transplantation data reporting. So I'll pass it over to Dale.
Fantastic, Keelan. I hope everyone can see that fine. Just really wanted to share some of our data we have. So we've got 44 Commonwealth countries have signed the MOU, which is fantastic. And our purpose really is the sharing of knowledge and expertise. Really, we're starting to build that community of donation and transplantation experts across the Commonwealth. And we're growing from strength to strength. But I wanted to just share some actual numbers. So we have 56 member countries of the Commonwealth, and as I said, 44 of those countries have signed the MOU. And one of the key aspects of the MOU is that, I'll read it, the signatory parties will commit to collating and annually sharing their national donation and transplantation activity to the Global Observatory on Donation and Transplantation, the GODT. And we have seen some progress. So you can see on this chart in 2018, there were 14 countries declaring their data to the GODT. And this is important that we all share, even if our number is 0, because we can't actually count unless we even know where things are. So then in 2019, Bangladesh got added, but unfortunately Kenya and South Africa dropped out. And then in 2020, Kenya and Sri Lanka joined giving their data. So we went up again, which is excellent. Then in Jamaica joined in 2021. Then Barbados was giving data, but we lost Malaysia and Sri Lanka. So you can see there's a bit of up and down, but Guyana and Malaysia and Sri Lanka all joined in 2023, and South Africa re-established able to give data in 2024. And I know there's some challenges with the GODT in giving data, and we'd like to work with them to make it easier. But nonetheless, we began the project, our MOU, in 2022, and we have seen some increasing in those numbers. But it would be great if we could, hit in 2025, because they're starting to collect all the data now for last year. Please send your data in. Well, and if you have trouble, let us know, and we can try to find ways to work with the GODT. Even if your number is 0, it's really important that we can actually see how we're going. And this is just a core part of the MOU. Now we'll move to some global data. So here, this is not just Commonwealth, this is everywhere. This is where we are as a world. And not everyone declares their data to the GODT, as we talked about. But if we look at living kidney donation first, it's risen 7% since the global pandemic. I've taken it from 2019 year, not 2018 year, because I thought that would be a better comparison. Living liver donor transplants has risen 29%, which is a huge increase, even growing quicker than living kidney donor transplants. When we come to deceased donation, it's risen 11% overall since 2019, so since COVID, and DBD up 2%, and DCD, massive increase of 41%. Now let's look at the same time periods, but looking just at the Commonwealth donation activity from the nations who've declared that. You will see in here that living kidney donor transplants has risen 31%, but living liver donor transplants has risen an incredible 97%. Total deceased donation is up 10%. Majority of that rise has been in DCD, but also rising in donation after brain death. So that's sort of some numbers for you there. So a little bit of so I went through the data. This was quite a manual process, so any errors here are completely my own. But what I wanted to see is the most improved in deceased donors per million since COVID. So I've taken the year before COVID, 2019, then up to the data from 2024. And to be in this little quiz here, poll, you had to have declared data to the GODT in 2019 and 2024. But a recognition of countries that have had any deceased donors in the last 5 years and declared that is Bangladesh, Pakistan, South Africa, Sri Lanka, and Trinidad and Tobago. Okay, number 3, drum roll, was India, with a 50% increase in donors per million population, rising from 0.5 to 0.8. Number 2 for silver, Cyprus has risen 85% in donors per million population, rising from 5 to 9.2 deceased donors per million population. And the number 1 country, Malaysia, 163% rise in donors per million population, going from 0.5 in 2019 to 1.3 deceased donors per million population. So congratulations, Malaysia, for that. But special mention I'd like to give is to Bangladesh, who in 2023 had 1 donor after brain death, and in 2024, 1. Pakistan, 2 in 2023 and 1 in 2024. And special mention to Sri Lanka, which has got some very high numbers there, but didn't make the cut, for 74 and then 70 in that rise. So recognizing all those countries that are sort of contributing to deceased donors across the Commonwealth. Now let's go to most improved living kidney donation since pre-COVID. So many more countries are doing living donation than deceased donation across the Commonwealth. And you can see there were 13 countries that actually declared data to the GODT in both 2019 and 2024. Additional countries with any living kidney activity declared in the last 5 years: Barbados, Guyana, Jamaica, Kenya, South Africa, and Sri Lanka. So bronze medal for Malaysia, which increased 62% in donors per million population for living kidney donation. And then Cyprus, another 85%, a very sort of good increase for Cyprus. And finally, the best was Trinidad and Tobago, 133% increase from 2.9 to 6.7 donors per million population. Special mention to Bangladesh with a 42% rise, Nigeria with a 37% rise, and India with a 27% rise. And I know percents aren't always the best way to show, but hopefully the per million population can really compare us across the Commonwealth. And finally, going to most improved living liver donation since pre-COVID. This is quite a new thing for many countries, but some have got well-established and very high-performing services. So there were only 6 countries who declared living liver donor activity in 2019 and 2024. And they are Australia, Jamaica, New Zealand, Canada, India, Malaysia, Pakistan, Singapore, and United Kingdom, with recognition for other countries with some activity in the last 5 years: Australia, Jamaica, New Zealand, Pakistan, South Africa, and Sri Lanka. Okay, in bronze, you will see United Kingdom, 48% rise. And it's a very new program for us in the UK. So there's quite a considerable rise for us. Pakistan, who's been doing very high numbers, has increased by 80% since pre-COVID. And India has increased by 88%. So Pakistan and India are certainly in getting substantial numbers in living liver donation. Special mention for Canada, which is 18% rise, rising to 2.53 living liver donations per million population. So just very quickly, we have the full data here. You can just run through this. You can see the different countries and how they're actually performing here. Then Guyana, India, Jamaica, Kenya, and Malaysia. And hopefully you can see this on the YouTube if you want to watch it again and see these slides in detail with Malta, New Zealand, Nigeria, Pakistan, and Singapore. And finally, South Africa, Sri Lanka, Trinidad, Tobago, and United Kingdom. So I think this is a really important piece of work. I'll go back to my opening slide that we sort of recognize our progress. But please, the most important thing I would say from my talk is, can we increase our reporting to the GODT, because that will be helpful for everyone. Thank you very much. I will stop sharing now and go back to Keelan.
Fantastic, Dale. Thanks very much for a really insightful presentation, as always. We encourage everyone to add questions to the chat. So we want to try and have some mini Q&A sessions between these sessions. So if you do have any questions, please pop them in the chat, or feel free to raise your hand if you're on the Zoom call. We'll also cover some of these questions at the end of the session. If there's nothing immediate, we'll move on to our next talk, which...
Can I just ask one question, Keelan?
Yes, please go for it, Sunil.
Yeah, excellent presentation, Dale, as usual. What about DCD? I mean, I know that that's one area which, is really growing. So in Commonwealth countries, there are very few countries which are actually doing DCDs. And, I think the number of per million population increase has been in the UK and some countries due to more contribution of DCD. So how many countries in Commonwealth are actually doing DCD donations?
Yeah, so in my latter slides, I've just counted up for you. So 6 countries are doing DCD. So if you want any sort of advice on DCD, United Kingdom, South Africa, New Zealand, Australia, India, with 2 last year, and Australia and Canada. So that's the spread of DCD. But hopefully we'll see more DCD growing as time goes on.
Thank you.
Fantastic. Thanks, Sunil. So we will now move on to our next session. We have a talk that has been pre-recorded from someone who's already spoken on a webinar for the Commonwealth Tribute to Life. Dr. Pritza Paul Vincent is a research fellow from the University of Bedfordshire, and he's kindly recorded a talk on the work he's been doing on the role of university students as organ donation ambassadors. So we will launch this. I want to make sure everyone can hear this. So please just give me...
It's in presenter mode.
Yeah,
if we just
there we go.
There we go.
Hopefully the sound will come through correctly.
Hello.
Yes, it's working.
I am Paul,
Great.
a research fellow and also the project lead for the NHSBT Community Engagement Project at the University of Bedfordshire. Today, I will talk about collaboration, which is a key driver for achieving large-scale impact in our project. Collaboration has been one of our core strengths, helping us reach a larger and more diverse population and create meaningful impact in the community. Following the completion of my PhD in organ donation, my journey with the NHSBT Community Engagement Project began in 2023 when we received a one-year grant to work with the multi-ethnic student population at the university to normalize conversation on deceased organ donation. This project was more of a co-produced initiative with students from the University of Bedfordshire representing minority ethnic populations. Working with our interns from the University of Bedfordshire, we began generating ideas to engage students and raise awareness on deceased organ donation. However, over the course of time, to create a broader impact, we needed to collaborate with community leaders and organizations beyond the university. One of our first major collaborations was with the Luton Borough Council. We already established networks through other university projects before, which helped build a bridge between the university and the council through the existing links. Through this connection, several community stakeholders became interested in contributing to our events. For example, as you see on the slide, during an event focused on Islam and organ donation, 3 representatives from the Luton Borough Council spoke to our audience. One of them was a 2-time kidney transplant recipient who shared a powerful lived experience that helped connect the concept of deceased organ donation with the community they were addressing. All 3 speakers came from ethnically diverse population and also religiously diverse backgrounds, which helped make the event more relatable to the audience. We also organized a movie night featuring work by a Nollywood filmmaker, Abiola, again using existing creative resources rather than creating new content. This approach allowed us to maximize impact using available community assets. These experiences helped us strengthen collaboration for our future work. Following the completion of the first phase of a community engagement between 2023 and 2024, we built a larger collaboration to engage with a larger community between 2024 and 2026. We expanded our partnership to include key stakeholders from Luton Borough Council, Luton and Dunstable University Hospital, which is a hospital in the catchment area of the university, Donation Committee at Bedfordshire Hospitals NHS Foundation Trust, Hospital Arts Studio, and Action on Blood. Our pre-existing relationship with the Luton Borough Council played a major role in community access. For example, the mayor invited our team to participate in the community events and agreed to illuminate the council building in pink during Organ Donation Awareness Week, as you see on the slide. The mayor also brought together community stakeholders and representatives who already had strong community connections. This helped us spread the message of deceased organ donation without needing to build new relationships from the beginning. One of our most successful activities during the Organ Donation Week was an event hosted at a Muslim community center in Luton. More than 80 individuals participated. What made this event special was the presence of a community mediator from the council and the community center. These individuals already had a pre-existing relationship with the audience, which helped to bridge the gap between our team and the community, allowing for an open and comfortable conversation about deceased organ donation. The council also helped connect us to a Nigerian community event in Luton, where the mayor spoke on behalf of our team. Additionally, a councillor shared her lived experience of being a 2-time kidney recipient, and she was from a Muslim background, and also she's from a minority ethnic background population, which stimulated meaningful dialogue and made the talk more relatable to the audience that we were addressing. We also engaged with the wider community during a Diwali celebration event attended by more than 400 people from the Indian community. Our banners and information materials helped raise awareness about organ donation and the importance of increasing donor registration among ethnic minority communities. Another important collaborator is the Hospital Arts Studio. This organization is funded by the NHS Blood and Transplant, and we are working together to co-create an organ donation art installation. The goal of this project is to improve the visibility of organ donation through public art. One of the major barriers we identified in research was a lack of visibility, and which led to the lack of everyday conversation around deceased organ donation. Therefore, there was a need to increase the visibility of deceased organ donation if we had to normalize the conversation on deceased organ donation. Media engagement also played a critical role in building collaboration. Between 2023 and 2024, we developed strong relationships with several media channels who were willing to film and share our community work. This increased awareness about deceased organ donation, about our project, and helped stakeholders understand that organ donation engagement was actively happening within the community. Increased media visibility helped us build trust, strengthen stakeholder interest, and create more collaboration opportunities for the. In addition to engagement with the news media channel, we also increased the visibility through other social media platforms such as X, Instagram, and LinkedIn. This helped in improving the visibility and also improve the conversation among the community that we were addressing in our project. In conclusion, collaboration has been central to our community engagement strategy. Rather than creating new relationships from the scratch, we focused on working through existing community leaders, organizations, and media networks. This approach helped us reach diverse population, bridge cultural gaps, use the resources efficiently, and create meaningful conversation about deceased organ donation. Thank you.
Wonderful, Britza. Thank you very much. And you're actually physically here after your recording. So I wonder whether you want to say any words, and Gertch Randauer, if you wanted to come in after Britza. Over to you, Britza.
Thank you, Dale, firstly, for the opportunity to present our work here. It has been really a great support from NHSBT to engage with the community through the Community Engagement Fund. What we did different here was, rather than we as like me and Gertch telling the students what to do, we engaged with the students what they wanted to do. How do they think that we could make this more creative and engaging with the community? So like creating games and movie nights, which attracted a lot of students. And one of the other thing they said was, people who speak about organ donation, they want to relate with those characters who are speaking in the public. Or so we tried to take stakeholders who represent the audience that we are trying to address. And also the art installation that we are working with Hospital Art Studio is more about co-creating art installation. It's with the public. It's not artist making an art, but it's with the public. How do they connect with the art? What art means to them, trying to understand it from their perspective. And we have finished developing the art. Soon it is going to be displayed in the community. So it's more like co-creating so that it relates to the public. So yes, this is in short that I wanted to emphasize about our work. Thank you.
Yes, the way we're going to second talk later on today about art. So, but over to you, Gertch.
Thank you. I guess firstly, just to say that this project is, if you like, part of a journey that couldn't have happened without the Commonwealth Tribute to Life. So the Mohan Foundation kindly partnered with us in investing in a PhD, which was Britza. So we wouldn't have the amazing talent that is Britza had it not been for the Mohan Foundation collaboration. And I guess the reason we were keen to share this project with people is we think this is something that could be easily emulated across the world. So every country has universities. All students are enthusiastic, energetic, passionate, and we need to harness that. So they're always looking for voluntary work or projects. So we've used organ donation as an example. We obviously are grateful to the seed funding that NHS Blood and Transplant provided to us. But we do think that across the globe, we could think about how university students could partner with local community groups to champion the conversation of organ donation. And we're happy to sort of provide more details. Britza's currently writing all of this up, so we can hopefully share that with colleagues too.
Yeah, wonderful. Yeah, it's showing the project of people coming together from across the Commonwealth. Is anyone willing to ask any questions? Feel free to jump in. So I was going to ask, yeah, Sunil, you go. So
no, you go ahead first.
You go, Sunil, you go.
So we in India are, we have an online program called Ambassadors for Organ Donation. And through that, recently we've started doing a small letter of understanding or a memorandum of understanding with colleges and schools to train some of their volunteers into our donation through this online program. And then, conduct activities in those schools and colleges and give them a grant every year and get a nodal officer appointed in that group so that there's a continuity. So we just started doing that, Gersh, and I'm very interested in getting Bridget to come and look at that. And if we can add more value to that, add some more templates, what you guys have done, it'll be great. Thank you.
Indeed, indeed. Vasanthi, over to you.
Hello, Dale. Very good presentations by all the speakers till now. This was very interesting, the one by Bridza. And I think maybe they could write to universities. And in addition, also there are organizations which cover the entire country, like the Employees State Insurance Corporation, the Central Government Health Scheme, and so on. So by that, through our webinars, we may be able to cover more audience in our own fraternity and students as well. So maybe it could be given a thought.
Yes, indeed. There's plenty of opportunity to really share this. I think, as Gertz sort of summarized, students are very enthusiastic people when you can really unlock a lot of creativity and actually can be motivating for us as we maybe get older and staler. The new generation can really help. Fantastic. We've got a lot to get through, so we might pause and go on to our next talk. So we're going to cross the world all the way to Guyana, and we've got Diane is here, Dr. Diane Nareen, who's a transplant surgeon, to talk about the work that she's done in the paired exchange. Do you want us to share your slides, Diane, or do you want to share your slides?
I'd like if I could actually put them up myself, if you don't mind.
Absolutely. We just need to make you a presenter. I think Keela and I will be working hard to do that.
I've briefly made you a co-host, Diane, so you should be able to now.
So if you just push share, the green button at the bottom. And it must be very early in the morning for you at the moment, so thank you for joining.
7:30 here.
Oh, I thought it was going to be worse, so that's actually
It's not that early, yeah. Okay, you can see the slides?
Yep, and if you just push present.
Okay, great.
Perfect, thank you. Over to you.
All right, so my name is Dr. Diane Ryan. I'm a general surgeon currently working in the transplant department. Our team is quite a small team for our country. I hail from Guyana, which is located in South America, but it's also considered part of the Caribbean. We're part of Commonwealth, of course. So I just want to talk to you today about a little bit of our recent peer exchange that we had. This was actually a little bit late last year. So chronic kidney disease, as we know, is a global health burden and very prevalent from country to country. In WHO, these are some 2020 statistics that showed that the deaths in Guyana actually reached about 233 or 3.2% of the total deaths, which for our population, which is about 800,000, is actually quite a large number. Kidney transplantation, however, is the treatment of choice for these patients with end-stage renal disease. And of course, there's some benefits over dialysis for all age groups. As of September 2024, these are statistics from the US. There are about 90,000 patients in the US actually awaiting kidney. In our country, we only currently do kidney transplants. We're unable at this point in time to do liver and pancreas, but of course, there are many patients still awaiting liver and pancreas donations from other countries. And because of this waiting list, even with deceased donor programs, there are still a number of patients that are still awaiting kidney transplants. Unfortunately, in our country, we don't have a deceased program right now, so all of our donors are actually living donors. And so we've like because of that, we've also been falling behind in terms of donors. So there's a lot of education that's still needed to push forward kidney transplants in terms of living donors. There are two main strategies that have been developed to overcome these barriers. So desensitization versus paired kidney donation. And this is basically the exchange of kidneys between two or more ABO or HLA incompatible donor recipient pairs. A little bit of the history. Basically, it was started in 1985, all up until 1990. The first paired kidney donation was actually done in South Korea, and then further done in Europe, and then until the 2000s actually started in the US, and then it's made its way further down around different countries. Guyana, we actually started our first peer exchange in 2018. So far, we've done 4. And of course, it tackles certain issues that we may have with certain patients in terms of incompatibility in transplants. Of course, it increases transplant opportunities for these patients, and some patients are actually able to get a better match out of being in a paired exchange. When do we actually consider it, or when do a lot of people actually consider it? It's all transplant candidates basically with a living donor who is medically able, but they cannot donate to that person. Or if they do, if they are even able to receive a kidney for that patient, but if they're able to receive a better match transplant would be consideration for peer donation. Outcomes, they've had 2 studies, which I actually came across in some of them more recent in 2017, that actually showed that the KPD transplant versus person-to-person transplant had the comparable, basically 1-year and 3-year graft survival rates. And these were 2 studies basically taken out of Canada and another one from the National Kidney Registry. So what has been our experience with KPD so far? So in Guyana, we have a number of patients suffering diabetes and hypertension. Those are 2 main chronic diseases that actually factor into chronic kidney disease. Our number of transplants per year is actually increasing. We have, even though it's a small program, so we've done last year, we actually completed about 15 transplants for the year. We've completed 4 pair donation from 2018 to 2025. And last year we actually did our chain transplant with 4 donors and 4 recipients. So how is it actually done here? We actually don't have like a national registry of patients for donations or recipients. These are patients that come to our clinic basically that have been referred from nephrology, and we have a list of those patients that once they have a potential donor, they're asked basically if they're willing to participate in a paired exchange in the event, for example, that we are able to find a patient or they're incompatible in some way. These pairs are done consecutively due to our limited staff and room availability. And the post-ops are closely monitored in our unit that is prepared. So this was actually our chain transplant that we were able to complete. This is between last year, October to November. This is the largest paired exchange that we were able to do in the country. And so these were the 4 donors and the 4 recipients. Actually, one of the recipients was actually the very first transplant patient that our program had done about 10 years ago. And he actually started back on peritoneal dialysis about 2 years after. And he actually completed his second transplant in this same chain transplant that we had. One of the patients was preemptive and 2 of the patients were already on dialysis. One patient was on dialysis for approximately about 6 months, while the female patient was actually on dialysis for about 2 years and awaiting a kidney. That female patient actually brought her son for donation, and unfortunately, because of incompatibility, he was unable to donate to her, and then they were able to take part in our chain transplant. So our challenges still remain with donor shortages because limited availability, because we don't have a deceased donor program, so we still rely on living donors. And public awareness and resources for us also remain one of the challenges that we also have. So we're constantly trying to educate patients in terms of, they always believe that, okay, they can only bring a relative for donation, or they're not even sure about how transplant works. So we're constantly trying to get their health center to actually take this up so they can actually educate patients further on transplant. Other challenges we actually have are their need for a formal registry and our lab resources. Currently, we are unable to do cross-match locally, so all of our samples are sent overseas for testing. And in some cases, if we don't have a match, we would actually have to ask them to do a virtual cross-match for us, so we can actually go ahead if we do think that there's a potential for us to take part in a paired exchange for any patient. This is actually a picture of our team during our chain transplant. We have a long vision basically for kidney health, and we would like to have a comprehensive renal care system with advanced transplant options. Hopefully, we can implement our disease donor program, and of course, implementing our education and policy frameworks for this as well. So in conclusion, peer transplant is a promising method to enhance renal availability. We need a successful implementation and requires some collaboration among medical professionals. And it has the potential to significantly improve patient outcomes, especially in our facility where we still rely on living donors. This was a picture of our team. Currently, this was in our PACU, actually, post-transplant of the last recipient that we had. So that is it for me. Do we have any questions?
Wow, that was totally brilliant. Margaret O'Shea, who's the regional coordinator for the Caribbean, said it was you're doing great work, but I'm blown away. That is amazing work. Often people talk about paired exchange in, like, saying the countries with big populations and really long established kidney programs, but you're showing it working, with a population of 800,000, which means that anyone could be doing this, which is fantastic. We just need to learn from you. Who would like to ask some questions? But that is I'm just astonished how great that work is. I'm looking to see if anyone puts their hand up. Waiting for.
I can make a comment if you wish.
Please,
yeah. Great work, Dan. I mean, really amazing to take a step forward. There can be some logistic challenges, especially if you don't have enough number of surgeons. And if you're doing consequential KPD, then sometimes if the donor from the second pair drops out, you could get stuck. That's the only fear which will always haunt a surgeon or the team of that happening. More so if by some bad luck, the first recipient doesn't do too well with that exchange, because you must be doing consequential, means you must be doing the next day or after a few hours after you finish the first one, right?
Yeah. So that does, of course, remain one of the mental loads that we have to take on. The team is actually, so we have our consultant. He's the transplant surgeon that actually would take part in the actual anastomosis and finishing the transplant. We have the 3 general surgeons that are in the department that we work. So it's a very small surgical team itself. So when we do have these cases, we sometimes would ask for assistance from our general surgeon colleagues, because we have 2 rooms available, recipient and donor. And because of our limited staff, we can only do 1 peer per day. So for this chain, for example, we obviously took about 4 days. So they were back to back, basically. There's always the fear that somebody's going to drop out or something is going to happen. What we do, we take away all devices from everybody so they can communicate, and hopefully they don't feel like, okay, if I give and something happens, that I will drop out of this chain. We meet with them so many times. We talk about this, and we even let them know that this is something that we worry about, and we hope that they don't do that. But generally, they've been waiting so long sometimes. They're very willing to partake, and they go for this with such good enthusiasm that we haven't come across that problem. I hope we never do.
I hope so. But when you start doing more and more, then you may encounter, especially when you don't have the backup of a disease donation. If something like this happens and you do have some disease donation going on, then you could give them assurance that we'll do something with the disease if there is a disease donor.
Yeah.
So that's all. Yeah, great. But wonderful to see KPD happening in countries like yours. Really a step forward.
Yeah, really
definitely better than incompatible ABO incompatible transplant. Definitely better.
Yes, ma'am.
That's risky.
Let's go
Thank you.
to Margaret.
Hi, morning.
I
You
know.
can hear me?
Yeah,
Yes,
fine.
ma'am.
We can hear you.
Yeah, I just want to echo the comment about the impressive program going on in Guyana. And what's also really great is being able to work up.
Hope you've just frozen, Margaret.
Has been great. And we also did a collaboration to start the program in the Bahamas last year within the region, surgeons within the region, and nephrologists going to the Bahamas and doing their first one in July. So, I mean, I see real progress in terms of unity within the region. And I think the more we are together, the more we can get done. And if one day we get a deceased donor program going in each island, then certainly there's opportunities to share do organ sharing within the region. So congrats again to Guyana, and they're certainly leading the way as far as paired kidney exchange is going.
Fantastic. And also, I assume the Caribbean Society of Transplantation will be a big topic for their discussion as well.
Yes, we had this presentation from her last year.
Wonderful. Keelan, over to you.
Yeah, really great presentation. Thank you. You mentioned that there's no formal registry for the distribution of organs yet. Is that an ambition for the future, or is the infrastructure not in place to establish that kind of thing yet?
We've been working on it. We've spoken to representatives from Ministry of Health. They're actually quite intuitive in trying to getting it started. So we're hoping that sometime soon we will have a national registry.
Okay, thank you.
Fantastic. Is there anything, Diane, the Commonwealth project could help you with your work?
Maybe I can reach out to Keelan if I can think of something, so we can let you guys know.
Very much, and if you're beginning any deceased program, there's plenty of expertise from many countries who'd love to help. With wonderful work, that's very exciting. They're very, very exciting. We're going to move to our next presentation, which is heading back to the topic of art and promotion. We've got Bhavna Jagwani from the Mohan Foundation giving a talk on promoting organ donation through diverse art forms. This is our last formal talk for the day, and then we'll just be talking about a few of upcoming events to close our Commonwealth Day celebration. Do you want us to share the slides at all, Bhavna, or would you like to share your slides?
We'll do it. We'll do it ourselves. Thank you, Dale.
Perfect. They're coming. It's still
Dale,
coming.
can you hear me?
I can hear you fine. Just waiting for it's loading up slowly. We'll wait for it. There it is. If you just start presenting. Perfect. Lovely.
Hello, everybody. Good afternoon, good evening, good morning. So I'm Bhavna Jagwani. I'm trustee in Mohan Foundation. And today we are presenting different art forms for organ donation. India, in the last 25 years, has emerged as a leader in South Asia. And India has performed about 18,000 solid organ transplants, 80% living and 20% disease donations. We have just covered 5% of the total requirement so far. Dale has already discussed the data, so we'll proceed from here. Next. The role of an NGO in India is creating awareness pan-India. Mohan Foundation has branches all over India, so we're creating awareness pan-India, training doctors and paramedics, nursing staff, everybody, training them to take the program forward, networking and liaising with the government departments, and we provide free counseling services to the families in government medical colleges who, when they have a brain death and they need counseling. So we give these services also. There is awareness on organ donation through art form. There are stage performances, dance, mime, musical. And street theater and street art, we have had competitions on short films and flash mob. Street names have been named after organ donors. A memorial has been built as a tribute to the organ donors in an art installation form. We have created posters, very artistic posters, t-shirts, which customized t-shirts, which promote the message of organ donation, and also in jewelry form. Here you can see, this is called Rangoli. It's a street art. Rangoli is a organic colored powder, which is used actually during festivals and traditional functions. It is very festive and looks very beautiful. It's supposed to ward off evil and welcome guests. But this powder has been used to promote organ donation. Here you can see the parking area of a metro station on a holiday has been used to create a competition depicting the message of organ donation in Rangoli form. It's very beautifully done. Then we have dance forms also talking about organ donation. In Indian mythology, Ganesha, Lord Ganesha was one of our oldest gods. His and baby elephant head was put on a human form. In today's time, it's called genome surgery, transplant. But this has happened 1,000 years ago in India. So in a ballet form, this story is being shown in creating awareness for organ donation. You can see this mime in the school promoting organ donation. I'll show you. These are mimes, and then these are street plays, street theaters. It's often around the government medical colleges and hospitals. Colorfully dressed people, they stand around, then drums are beaten so that people's attention is drawn, and then they enact some plays and promote organ donation through the storytelling. It's very interesting. Then Mohan Foundation had a inter-college competition in which they created, took in entries for ad spots and short film competitions, and a small film is being shown. This is, the theme was Give a Second Chance at Life. This is recycling paper, so why not recycled organs? Just a small portion is shown to you. Yeah, so when paper can be also recycled, why not organs? Now we have musical events. We have this Ranjini and Gayatri, who are classical vocal singers, fabulous singers. They performed in a metro station, and there were humongous crowds all looking at them. And this was in promoting of the message of organ donation. It was on the 50th anniversary of the first heart transplant in the world, and also 20th anniversary of Mohan Foundation. This is a flash mob, which you can see done by school children in the malls. Some.
Probably not.
These are posters created. Some of them pop up and they're really so attractive that you can see. These are created by students from all over India. Next. These are coasters which have a message of organ donation on them, and they can make lovely gift items. This is the iconic Qutub Minar, which is a very big heritage monument in the center of Delhi, our capital. And it's beautifully lit up with green lights depicting organ donation. This is also, there's next to it is also the Hawa Mahal, the Palace of Winds, it's called in this place. It's from Jaipur. It's also been lit up in green lighting depicting organ donation. Subsequently, many hospitals also have green lighting on them on Organ Donation Day in support of organ donation. We have this human ashes which have been converted into models of organs which are speaking that please do not turn your organs into ashes. Please pass on life, give life to somebody, give the gift of life. These are beautiful ash models, and they have got a national recognition and national awards for this life before ashes model. Then we have these beautifully artistically created t-shirts. They are customized t-shirts with messages of organ donation. This is a piece of jewelry which says all castes, creeds, and all religions. We have many religions in our country. They are all connected and all support organ donation. You can see the green ribbons on the necklace. And this is me as a jewelry designer. I just created this little piece of jewelry. But then we have the Angdata Smarak, which is a big installation, maybe 15 to 20 feet tall. This man, it's a human form, which is looking up. The circle is the Almighty, the sun, the moon, whatever we call it. And it has, you can see pipes behind it. These are pipes. So this human being is saying gratitude to God for passing on life to so many people. Behind him are those pipes, which are the human forms human beings who got life. So it's very beautifully depicted, and the names of all the organ donors are put in colorful name plates, as you can see in the above picture. This is one of the small reel which has got a national award. And this installation on organ donation also got a world recognition for this installation.
There's no sound coming though.
Don't worry, we'll add sound into the video recordings when we put it on the YouTube after the talk.
Thank you so much. Thank you for listening. I was so grateful.
Thank you, Bevan. Well, really well presented, and wow, there's so much color and activity. I'm jealous about how many different projects you shared with us. Open up to the floor to anyone to want to talk about some of this great inspirational artwork that's happening through the Mohan Foundation and in India.
Thank you so much.
Gurch.
That's absolutely amazing work. I guess in the spirit of sharing and not wanting to reinvent the wheel, what's the feasibility of, so I use the t-shirts as the example of turning this into a sort of a global product, because I think a lot of the imagery and the messaging it's so beautiful, it's so impactful, and it's global. And I wonder how we can find a way of sharing some of these resources so that other countries could maybe just think about learning from you. And if you were kind enough to do so, we could literally use the same designs.
It will be our pleasure. I mean, it's a common cause for the common world, and we are all in it together.
I think that's amazing. Yeah, I've been wearing an Orgamites jumper around, and actually a number of people have come and asked me. Just like it's more visually striking, and so what we can do, and some of the beautiful jewelry as well is I could see that it's really, it gets people talking. Vasanthi, over to you.
Hello, Dale. I remember in 2019 we had organized an inter-university competition where we had face painting, rangoli, the flash mob, and all the activities that we spoke of now. So one more thing which I thought was, like yesterday we had the T20 final, and there we see, of course, people painting their country's flag. But in such incidents, if we can promote people to also paint their faces with, either symbols of art or whatever, or some messages, or if they can be distributed T-shirts which show such messages, I think it would work wonders.
Yeah, it would just and actually having easy designs that people can copy, and so if you go into a face painter, they can see what's required. It just makes their job easier. So it's a wonderful suggestion. Job, over to you.
Oh, yeah. Good to see
Job,
you.
good to see you.
Thank you so much. It was a great presentation. I think we have a lot to learn from India, and I hope we could have more of such interactions for us to learn, especially for us that are just learning, that are just starting organ transplant. I think we have a lot to learn. Thank you so much for the great presentation. Thank you.
Yeah, thank you for that comment, Job. I hope you're doing well. Keelan, over to you.
Yeah, thank you again for another really good presentation. I suppose it's more of a comment than a question. I mean, first of all, it's brilliant to see the diversity of art forms that are being used to promote organ donation. Things like the Life Before Ashes exhibition are really kind of groundbreaking, it seems. Building on what Gert said, I think there's a real opportunity to do more regarding sharing what is going on in countries and sharing these art assets that different countries are building. I mean, you've showcased a lot of what India is doing today, but we know other corners of the Commonwealth, like Singapore, have really pushed on and relied on art as a platform for raising awareness. So there's a discussion to have, I think, hopefully after this webinar, about how we can start pooling these resources and sharing them, so countries don't have to start from scratch and can start using art as a lever for organ donation.
Absolutely, indeed. Actually, Keelan, I think that could be a wonderful segue into sharing the new website as a way of becoming this knowledge library. So if we thank you for the 4 speakers we've just had today, and we're now just going to take a little bit of time in the last few minutes. We're going to sort of another 10 minutes to share the new website and some events that are coming, and then we'll let Dr. Sharma close us out for Commonwealth Day celebration. Keelan, do you want to share your screen and share the website?
Yeah, sounds good. Hopefully you can all see this. So we've been working on trying to develop the Commonwealth Tribute to Life website. It previously lived as its own section in a different website on the NHSBT clinical platform, but we wanted it to have its own place, and that place is now cttl.life. We're still building this out, and it will develop a lot in the coming years, but this will now be the hub for everything we do and tracking the progress of this project. It's broadly separated into 6 areas: the network, background, knowledge, achievements, the MOU, and a contact sheet. I will briefly show you through all of these. On the homepage, we have basic information about the mission statement, upcoming events, we'll get to this in a second, and what the project is for. The network, is an important part of this new platform. So the network is supposed to help guide people and make the connections that we've seen can be so fruitful already in the project. Many of the best outcomes we've had have come through just connecting people throughout the Commonwealth, so they can share best practice or share knowledge on the topics we've explored today. So there's an interactive map which allows you to click on countries, and it will load the contact information of the representative to the MOU from that country. This can also be seen as a list. So hopefully easy to navigate, but this is something we need to build out over the next year as well. Currently, it only has the signatory members, but we want to develop this into something where people can find someone that's in charge of promotion, someone that's in charge of, maybe clinical transplantation regulation, so on, from specific countries. So there's not just a single point of contact in these countries. This page also highlights the governance and the supporting organisations. The background section gives a brief overview of the project as it develops and key events and landmarks from its inception to today. The knowledge library is another one of the main pillars of this website. So we want to add all of our key knowledge assets to this platform. Currently, it only has the webinars, but these are easy to access. You click on it and it appears. Some of you will recognize this from our webinar series 2 years ago. And they're organized based on guidance documents, webinars, how-tos, research, and so on. We really want to develop this into something quite important, beyond just sharing webinars, but also sharing things like guidance documents, like regulatory frameworks. But also, I mean, we've discussed it today. This space can be used for things like art assets, and sharing those so other people can use them. It should be seen almost as an open source organ donation and transplantation knowledge base that anyone in the Commonwealth Tribute to Life can use. Finally, we have an achievements page. This is still being built out, but we'll host all of our achievements and progress to date, organized by sections. A live version of the MOU, which can be downloaded. You should all be fairly familiar with that by now, I'm sure. And then finally, a contact sheet where we encourage people to contact us through this now. And it allows us to make connections for people, but also to help support other initiatives as and when it's requested. That is a broad overview of the website. I don't know if anyone has any questions, but equally, we're looking for people to help maintain this website and build it out from around the Commonwealth. So if there's any expertise or willingness to help volunteer to build this website and maintain it, please do get in touch. Thank you.
And thank you. Special thanks to Keelan for his huge work to make that. It looks very attractive and modern, and will really sort of help grow the project. But yeah, if you are motivated, and you don't need to be a website designer, just need to be motivated for helping with content sharing, and that'd be fantastic. Any sort of comments before we finish by going to the events that are upcoming?
I just want to say, Dale, that great job done by Keelan on the website. I think, if any of the activities which are happening in the region can be reported to Keelan with Tribute to Life, it'd be good, because that gets populated. And in other achievements, Keelan, we also have apps. I'll give you the links for all the apps we do. I'll send you the links both on App Store and on the other store, Google Store. So I'll send you those as well. Plus we also have some. We used to have, there was NHSBT, but we do have some reports which we can share. Maybe have a look at it. If it has any meaning, it can be put on the website as well. So I'll share some of these achievements, a few more with you, so that you can complete that area. Thank you.
Thanks very much, Sunil.
That's fantastic. That's a great ideas, both of them. Okay, so really next comes to share some events that are upcoming. So one event is more of a regional event, and so you can feel free to share it if you want to share any events as well. One is that on the 25th of June, we have a Scotland and Commonwealth celebration event for Scottish donation transplantation and Commonwealth donation transplantation happening, because as you may be aware, Glasgow is the host for the Commonwealth Games. And so that'll be in July, but in the last week of June on the 25th, we're having a special day in Glasgow. So if you happen to be in Glasgow or heading in the UK, you're very welcome to let us know, and we'll try to accommodate you. We will try to record some of the talks, but it won't be a hybrid event. It can't be. Sunil, do you want to say anything?
We on 3rd and 4th of April, we are having an event. We are having we give a couple of hours to Tribute to Life event, which is we are hosting this in Indian Institute of Management in Ahmedabad, and we do have this. We are trying to make a small regional meeting as well. So in those 2 hours, we have one delegate coming from, or rather, for faculty coming from Malaysia to attend, one coming from Bangladesh, Dr. Harun, and Sri Lanka is participating online. And Dale, I think you'll be online as well, if I remember. So we will be having the event. We'll let you know the exact timing. I think it is between 5 and 7 o'clock Indian time, which will be quite okay for people to attend from other countries as well, I think. So we will make the announcement, and we'll send the flyer very soon, within this week itself, in fact,
Excellent. Yeah, thank you for that. Anyone else want to tell us any events before I get to the main event that's coming for 2026?
Yeah, this September one. Yes, 26.
Yeah, that's the main one. Yep. Anyone else got another one they'd like to share? If not, I will go to. Hopefully, you can see that. Okay. You can see a very big event that is coming to Australia. So they are holding their Donate Life Symposium in conjunction with Commonwealth Tribute to Life. It's going to be on the 18th and 19th September. That's a Friday and Saturday in Sydney. It won't be a hybrid event, but they may be able to record it. But we're really hoping you'll come face to face. And if you're wondering why those 2 days, it actually is the day before the Transplant Society meeting. So the Transplant Society, the World Transplant Society, is actually meeting in Sydney from the 20th of September, from Sunday, the 20th of September. So if you're planning to come to the TTS in Sydney, why not come 2 days earlier and come to the Commonwealth Tribute to Life event with Donate Life Australia? And if you reverse might be, come to that event, the Donate Life Commonwealth Tribute to Life event, and then stay on for the TTS, because that's certainly what I'm going to be doing. I'm going to this event and then staying on for the TTS. I don't think anyone is from Australia on the call late at night there. No, I don't think there is, but we're giving you more details to come and flyers. But please look at coming and share with your networks, because someone you know, if you know anyone coming to the TTS, see about getting them to come a day or two early and joining this fantastic Commonwealth event. We'll be sharing more of what we've heard today and really supporting Australia in their own work going forward.
We've shared a promotional image in the chat, so please feel free to use that as you recruit locally for this event.
Yes, indeed. So you can download it from the chat. If you just right click on the chat and just do save as. I'm doing it right now myself, and you can actually you can download. Say that it's not working for me right now. I hope you're all succeeding, but we'll send it around as we speak. Well, that concludes our Commonwealth Day celebration, but I'm going to let Dr. Sharma, Satya, you please have the last words.
Thank you, Dale. This webinar has illustrated the points quite amicably and also clearly that there is a merit in sharing the ideas. And as far as sharing is concerned, lots of things have been said, and our new website has got the place where people can share the ideas without having much of a problem. So if you have new ideas, if you have got something which is very successful, please do use the website to be able to share this widely. Well, I'm really pleased that this webinar has gone so well, and I would like to thank the speakers, all the speakers. The idea really is to have every 2 months these webinars, and if you have volunteers coming along for webinars, that'll be very helpful. So feel free in approaching Keelan for your ideas about the next webinar or the following one, and it'll be great. So thank you very much indeed. It has been a pleasure attending this webinar, and I hope that you all are taking some messages home. I'd like to close the meeting and thank you for your attendance.
Bye-bye, everyone. Happy Commonwealth Day.
Thank you.